Hey, this is Josh with Iowa American Rescue, and today we're going to learn about one of the most effective and underutilized trauma treatments you can perform as a civilian. Here's a hint. It doesn't run the risk of accidentally hitting a subclavian artery if you never actually practiced it with a competent instructor. An emergency blanket is a lot like a peer-reviewed research study. Everyone has access to them, but nobody really knows what to do with them, so instead they throw them out in favor of things that sound cool. Paramedics in the pre-hospital and critical care interfacility transport environment frequently use warmed IV fluids as a part of their overall patient care. And as a civilian, I recommend you keep a few of these blankets handy. The reason for this is because all major trauma protocols involve hypothermia prevention. Now, at the risk of oversimplifying this, the reason is that warm blood clots better. When trying to prevent someone from bleeding out, blood clotting is critical in managing bleeding that can't be managed otherwise, like through a tourniquet or wound packing. Now remember, those bleeding control skills are important and need to be performed first. But after bleeding is controlled and the airway is opened and maintained, think about the possibility of hypothermia in your patient. Even on a warm spring day, your patient can have a severe reduction in body temperature. So, before you go reaching for high-speed tools like a chest needle, think about what the 70-degree pavement might be doing to your otherwise 98-degree patient. So a lot of first aid kits or trauma kits will have these little blankets inside them. They're pretty easy to fit in there. I promise you, it's not just so that they can sell you more stuff and add to the list and make it look like there's more in there. There's actually a lot of good uses for them, and it's something to keep around. Again, that starts in a package about this size and goes up into something this size. So, as you can see, there's a lot you can do with them. They are very useful, and again, before you go looking for high-speed, tactical type things, why don't you focus on the basics that might actually save your patient?